Okay, my presentation, I will just briefly talk about the training, why we did the training, and a brief description of the sites, the participants, and the training content briefly, and the results of the training, and conclusions. The South African education system has witnessed progressive legislative and policy reforms. We have new sort of reforms to address the inequalities of the past. One of these reforms is about educating the learners with disabilities. And in 2001, we had White Paper 6 called Building an Inclusive Education and Training System. And this is a document that stipulates the strategic planning and how the process of implementing inclusive education. And one of the codes, it's talking about the aims, is saying it's about supporting all learners and all the education system as a whole. So it's about having a holistic approach to inclusive education and overcoming the barriers in the system that prevent it from meeting the full range of the learning needs. I think you can see the keywords there. It's about the system. It was no longer the old medical model. So we had a move from the old special needs kind of education towards an inclusive one, where the teachers and the professionals were going to be trained in terms of assessing and looking at addressing the barriers in the system and within the learners. And we had new roles now for the professionals and the institutions that we have now. They had new responsibilities. And the shift was from the old one, as I said, where we have the basis from the medical model, where it was about the child and having the child adjust to the classroom and all those things. And we are moving now to the social model, where it's about the support model, where all the learners need support. That fact is being recognized, and the environment had to be adjusted. So the training that I was involved in was a private company that sells AEC devices that got a tender from the government to supply the devices in the schools in the two provinces, Gauteng and Mpumalanga. So the way the inclusive education policy is structured in the country, we have the 4 levels that are working together. We have the national department, which makes the policies and sees to it that they be implemented, and the other level is at a provincial level, where the province also looks at the provincial policies, monitors implementation. And thereafter, we have the third level, that it's up with the district offices. In each province, we'll have numerous districts where they support schools in implementing the policies, and they monitor and support. And in those districts, we'll have a team which is at the core of implementing this inclusive education. It's made of representatives and from all professionals, including people specializing in curriculum planning, further education, and human resource development. So the role of the district is to work together with the school-based support teams to support them, especially if the schools has therapists or education therapists, so that they can support the learners who've got learning needs. Sometimes if the school doesn't have a health or sort of a therapist person in the school, the district will provide a direct support to the learner. And the schools, however, at their sites, they're expected to have their own teams where they'll sit as a staff and look at the issues on providing support. And it is within this context that this company, Inclusive Solutions, was approached to supply and train on AEC devices in the schools. We have 9 provinces, and other companies were approached to do the other provinces. So I'm just talking about the 2, but it's a huge project where other people are involved as well. Okay, and the support structures that we have to make sure that the policy is being implemented, we have the ordinary schools. So our training also happened in those 3 sort of types of sites. The ordinary schools, some people went to full service schools and special schools. I did most of my training in special schools and in some full service schools. So according to the plan is that the personnel and the environmental experts will work together in providing this inclusive education. And the delivery arms of the inclusive policy is school-level support teams, or what they call ILST, institutional level teams, and the district-based support teams. After they've done this, what we call the screening and assessment tool, which is being developed, is not yet finalized, where the staff is being trained on how to assess and match the learner with the support that they need. So they will be ordinary schools will provide low levels of support, and the second level, the full service schools, will provide moderate levels of support, and special schools will provide the high levels of support. The training, the people who were involved was mostly teachers in those schools, in the settings. Some schools had therapists, some schools involved a social worker. Very few social workers available in schools, but there are some schools that have. And some provinces, the district officials came to the schools to attend, but very few district officials did attend. All in all, we are about 43 schools, 24 in Gauteng and 19 in Mpumalanga. I think all in all, it's close to 200 people who were trained, about 100 in each province. The trainers, it was mostly therapists, teachers, advocates, and we had a technician as well. We are all experienced in working with special needs population and all trained as AHC practitioners. The objectives of the training, which occurred over a 2-day period, two full days, which was listening to the first speaker who did 60 hours. Ours was very short, and as you can see, the challenges that I'll discuss later on, we can't do much in that time. So we worked on just orientating the participants to the AAC devices. You know, we had also software that was supplied to the schools by the Inclusive Solutions Company through the Department of Education. We worked on planning and agreeing on the roles and responsibility of the teachers or the team towards the security, the management and the maintenance of the devices. And we had to agree on the follow-up support in addressing the challenges that they are going to be experiencing. So this is the first part, the 2 points, and the follow-up support hasn't happened. It's going to happen in a few months' time. We'll be going back into the schools to provide this follow-up. The method, we did a lot of modeling, direct instructions, activity-based, we had role plays and case studies. And so these are some of the devices that we trained on, like the computer access devices, like the joysticks, roller balls, and we had a lot of message devices, starting from single message devices like Big Mac to this top of the range was these ones, Go Talk 20 and TechSpeak. Okay, the results of the training, the outcomes, start with the positives. Indeed, it was very successful. A lot of the participants said they were enthusiastic and keen, and they felt that they were empowered. The comments that they said afterwards, this is based on the comments that they said with the groups after the training. They felt empowered and they learned a lot. And some of them were willing to train the rest of the staff that didn't manage or they were not selected to attend the training. We had a positive in that in some schools it was easier. That's where it was more success, where we find that the teachers already had some formal training in AAC or informal training, because a lot of the schools have, they had staff being trained at the Center for AAC in Pretoria, which Kitty and Juan will be talking about. So we had some schools that had people that have formal training, and it was much easier in those sites to train. And those schools also had teachers, somebody was mentioning earlier on computer literacy, you know, working with software and AAC devices, you need to be computer literate. So it was a pleasure to work in those sites where the people were able to use the computer. And some of those schools were well resourced. They would have enough computers to install the software and, you know, to buying consumables like printing paper, laminating machines to do communication boards. So it was okay there. And the challenges, I would really say the readiness was a big issue. We felt that some of the schools were not ready, especially those schools that are, I said they are called the full service schools, where it's mainstream school that is going to be accepting learners who've got moderate or mild sort of support needs. They were not ready. They've never had a child with a disability being admitted before. So they didn't know what we're talking about. A child who's got no speech, non-verbal child. So it was not easy to train them because they haven't started as yet. Because the policies, the plan is from 2001, it's a 20-year policy. So those schools are being prepared already, but they haven't really started doing much. So it looks like the system is moving faster than the people on the ground. We had issue of security, where the teachers were concerned about safety. If these things, the theft, we have crimes in areas, so it was a big issue, how we're going to keep them safe. And also, I think the plenary this morning, Professor Missing was talking about bullying. In the schools that I train, a lot of people complained about bullying, that even though they were special schools, there was so much bullying. So the non-verbal children would be bullied by the ones that are not, that are verbal, but having other disabilities, and they worried that it's going to be taken, their devices might not be sort of safe in that kind of setting, because bullying was an issue. And also in some places we had teachers who were not ready for inclusion, and they're not understanding this policy. They still want to remain special schools, super specialized. They don't understand the process of implementing, going towards the social model in education. Access to technology was a big problem, where the schools, you would have one computer which is used in the administrative office by the secretary or receptionist of the schools, and having this lot of software that we brought to, and the software like the grid, board maker, and where are they going to install? They didn't know, what are you going to do? We've got all this provided for us, but we don't have computer, we don't have printing. So there was access of, technology, like even internet access in those schools. So I found that there was still a problem with the old problem of rural-urban divide, where the rural schools, especially in Mpumalanga, where we have a lot of rural areas, they're still struggling about these basic things, where they don't have computer sort of access, and they don't have, most of the teachers they're not computer literate, they've never worked with a mouse, and those who know the board maker and the grid, it's about mouse control, and it's a big problem, and the phobia of using technology is still rife in those areas. And also the issue of the previously advantaged against the previously disadvantaged school is still there. We find that the previously sort of in the old white schools still have a lot of resources, and the schools in the township, they're still poor, they don't have resources. There was still a bit of a problem in that sense. And parental involvement is still a big issue. As we heard this morning, poverty, I like Professor Emerson was talking about those kind of hazards that you have when you're working in areas where there's poverty. The parental involvement, it is a big problem. And the schools, as soon as you talk about ACN, the teachers will be excited, and they will realize immediately that we need parents to be involved, but it's going to be a problem. The parents in the schools are not involved. So in conclusion, I would say that what we learned from this process is that the training, that this kind of AAC training needs to be coupled with a number of processes. For example, institute training, where the teachers, they knew how to use the products, but they didn't know which child will be appropriate for which product, how to match the children. The issue of computer literacy, I think computer literacy has to be done well ahead before we can introduce sophisticated devices like this. The funding issue about, some schools, they didn't know where they will buy the printer, they don't have money for all those needs there that go around with having this technology. There's no policy on assistive devices, so it is a problem how, when the schools are aware that this child needs something, but what is the policy? We still don't have that policy. The security, as I've said, is a problem. And the readiness and conducive environment, where the teachers actually are, the attitudes are changed around inclusive education, understanding the social model of education, and also being sort of trained into curriculum adaptation, because some of them would complain that I don't know how to include this in my in my curriculum. How do you adapt a curriculum with a child who uses an AAC devices? Finally, I would like to say toda raba to Beit EC Shapiro for inviting me and for the warm welcome and making me see this beautiful country, Israel. Thank you.